Anitocabtagene autoleucel is a very novel CAR T. One of the unique thing about anito-cel, it has a synthetic. The binding domain is a synthetic protein called D-domain, and D-domens are a triple alpha helical structure with a hydrophobic core. So what it really does is it gives a very high transduction efficiency, high surface expression of the CAR on a cell, and also leads to low tonic signaling because of the small size and lack of side chains. So these are the unique attributes of this product. And we tested this in a phase 1 dose escalation, first in human study, and we are presenting the long-term follow-up data at this meeting. We enrolled about 40 patients. Out of that, 2 patients were not dosed not because they didn't have successful cell manufacturing, but because of the patient-related comorbidities. So a total of 38 patients were dosed. Initially we have 6 patients in a dose escalation dose level 1, which is 100 million cells, and then 6 patients in the dose level 2, which is 300 million cells. But based on the early data, the decision was to expand dose level 1. So additional 26 patients were enrolled in dose level 1. So total of 32 evaluable patients in dose level 1 and 6 in dose level 2. Now in terms of the baseline characteristics, these are the very heavily treated patients. 100% of the patients were triple class refractory, and 68% were penta-refractory. About 34% of the patients had extramedullary disease, partly because this study also allowed patients with non-measurable disease but measurable plasmacytoma to be enrolled in the study. And 63% of patients had what we call as a high-risk prognostic feature. And the way we define the high-risk prognostic feature is those with bone marrow plasma cells of more than 60%, ISS stage 3 disease, and extramedullary disease. So in general, the baseline characteristics of the patient population suggest a patient group with a very poor prognostic feature with an unmet need of novel therapies. Now, in terms of efficacy, we saw a response rate of 100% in the entire patient population. The complete response and better rates were about 76%, and 92% of the patients had a very good partial response rates at better. Now, what is impressive is that in the CR and better rate, in the subgroups, including the patients with high-risk prognostic feature, extramedullary disease, high-risk cytogenetics, with and without 1Q gain, and age more than 65 years, were pretty comparable. So it's pretty impressive data. Now, at a median follow-up of 26.5 months, this is the long follow-up that we're going to present, the median PFS was not reached in the entire patient population. The 24-month PFS rate was about 56%. And of course, the patients who are in CR and better, also the median PFS was not reached there as well. Now, what is impressive, I would say the most impressive finding in the study is that in the extramedullary disease group of patients, which is about 13 patients treated, at a follow-up of 33 months, the median PFS was not reached. So that is quite impressive. And then if you break down the time points of 6, 12, 18, and 24-month PFS rate, in the overall patient population, the subgroups, the 24-month PFS rate was overall more than 55%, and is perhaps one of the highest PFS reported at 24 months, especially in the patients with high-risk prognostic feature like extramedullary disease. In terms of safety-wise, we didn't have any new safety signals. There were in the dose level 2, there seemed to be increased risk of higher grade CRS and ICANS, but in the dose level 1, which is the recommended phase 2 dose, there is no grade 3 or higher CRS and only 1 grade 3 ICANS. We did not observe any delayed neurotoxicities. There are no Parkinsonian-like syndromes, no cranial nerve palsies, and no Guillain-Barré syndrome. So in summary, anito-cel is a unique and novel CAR T based on its novel binding domain with clinical attributes of high transduction efficiency, high surface expression of the CAR binding protein, and low tonic signaling. And these attributes definitely have enabled a clinical activity that is on, with a 100% response rate and 76% of patients achieving more than CR, and at median PFS not reached in 26.5 month follow-up. That is quite impressive. And more impressive is that this efficacy is paired with the very manageable safety profile with no delayed neurotoxicities. So this study is right now ongoing in terms of the phase 2 pivotal study and enrolling patients, and there is a phase 3 study already being planned or anticipated to start in the second half of this year, where we're comparing anito-cel with the standard of care in 1 to 3 prior lines of therapy who are exposed to anti-CD38 monoclonal antibody and immunomodulated drug.